Hi everyone, Dr. Sadaf Qureshi here, and today we are going to talk about Engel's classification of malocclusion. Edward Engel in 1899 gives classification for malocclusion. It is useful classification because of its simplicity of use. Engel's classification is based on mesiodistal relationship of teeth, dental arches, and jaws. As according to Engel, maxillary first permanent molar is key to occlusion. And it is because he considered maxillary first permanent molar as fixed anatomical points in the jaw. And that's the reason he based his classification on the relationship of upper first permanent molar to the lower first permanent molar. Talking about Engel's classification, Engel classified occlusion into normal occlusion, class 1 malocclusion, class 2 malocclusion, and class 3 malocclusion. Here we can see the first category is about normal occlusion and the other three categories about malocclusion. So class 1 malocclusion is second category, class 2 malocclusion is third category, and class 3 malocclusion is fourth category. Class 2 malocclusion is further subdivided into class 2 division 1 malocclusion, class 2 division 2 malocclusion, and class 2 subdivision. And so like class 3 malocclusion is further divided into true class 3 malocclusion, pseudo class 3 malocclusion, and class 3 subdivision. We will talk about each of the classification and why they are classified in this way. So let's start our topic with the normal occlusion. Normal occlusion is characterized by the following aspect. The first aspect is class 1 molar relationship. What is class 1 molar relationship? Class 1 molar relationship is when mesiobuccal cusp of maxillary first permanent molar occludes in the buccal groove of mandibular first permanent molar. That's how they make the class 1 molar relationship. So this is class 1 molar relationship when mesiobuccal cusp of maxillary first permanent molar occludes in the buccal groove of mandibular first permanent molar. The second aspect of normal occlusion is the proper arrangement of teeth in the dental arches. So these are the two aspects on basis of which we can classify occlusion into normal occlusion. The first is class 1 molar relationship and the second is proper arrangement of teeth in dental arches. Now we will talk about class 1 malocclusion. Class 1 malocclusion is characterized by the following aspect. The first aspect is class 1 molar relationship. As we know, class 1 molar relationship is mesiobuccal cusp of maxillary first molar when occludes in the buccal groove of mandibular first molar is the class 1 malocclusion. As we know, normal occlusion and class 1 malocclusion both has the class 1 molar relationship. But what make them different? What make difference between class 1 malocclusion and normal occlusion is when class malocclusion is when there is discrepancy within arches, that is transverse relationship of arches or vertical relationship of arches. Both type of discrepancies can cause class 1 malocclusion. The second reason for dental class 1 malocclusion is when there are dental irregularities. Dental irregularities may be crowding, spacing, rotation, and missing teeth. The next factor for class 1 malocclusion are the local factors that cause class 1 malocclusion. That may be displaced on impacted teeth, anomalies in size of teeth, anomalies in number of teeth, and anomalies in shape of teeth. Any of these things can cause class 1 malocclusion. So, talking about the patient's facial profile and skeletal relationship, these patients have normal skeletal relationship and normal muscle function. As you can see there, this is facial profile of class 1 malocclusion. They have normal skeletal relationship and normal muscle function. Moving towards the next class, that is class 2 malocclusion. Class 2 malocclusion is characterized by following aspect, that is class 2 molar relationship. Whenever there is class 2 molar relationship, that occlusion is categorized as class 2 malocclusion. Class 2 molar relationship is when distal cusp of maxillary first permanent molar, so sorry for the errors, this is distal cusp of maxillary first permanent molar. It occludes in the buccal groove of mandibular first permanent molar. This is called as class 2 molar relationship. In class 1 molar relationship, mesiobuccal cusp of upper or maxillary first permanent molar was occluding in the buccal groove of mandibular first permanent molar, but in case class 2 molar relationship, distal-buccal cusp occludes in the buccal groove of mandibular first permanent molar. As we know, class 2 malocclusion are further categorized in three categories: class 2 division 1 category, class 2 division 2 and class 2 subdivision. First, we will talk about Class 2 Division 1. Class 2 Division 1 is characterized by following aspects. The first thing is, in all of these Class 2 Division 1, Class 2 Division 2 and Class 2 Subdivision, they will be having Class 2 molar relationship. So what is Class 2 molar relationship? Class 2 molar relationship is when distal buccal cusp of maxillary first permanent molar occludes in the buccal groove of mandibular first permanent molar. This is called as Class 2 molar relationship. Other than that, class 2 division 1 should be having procline upper and central incisor. So whenever there is combination of class 2 molar relationship and procline upper central incisor, that kind of occlusion is categorized as class 2 division 1 malocclusion. Talking about the abnormal muscle activity that is present in class 2 division 1 malocclusion, we will first start with the upper lip muscles. Upper lip are hypotonic and short and they fail to form the lip C. Talking about the muscles of lower lip, they cushion the palatal aspect of upper teeth and this situation is called as lip trap. And this is characteristic feature of class 2 division 1 malocclusion, that is lip trap. Talking about the tongue muscle, tongue occupies lower posture in mouth, so it fails to counteract the buccinator activity. And when the buccinator activity is more, it causes narrowing of upper arch at premolar and canine regions. As we know, in class 2 division 1 malocclusion, there is abnormal muscle activity, so there is hyperactive buccinator and mentalis muscle. So whenever there are hyperactive buccinator muscle, hyperactive masseter muscle and altered tongue position, that is lower tongue position, that cause narrowing of dental arch, especially at premolar and canine region. So this is how the arch shape changes. It causes the arch shape to become V-shaped arch. So in class 2 division 1, there is class 2 molar relationship. Upper central incisors are procline. There are presence of abnormal muscle activity and the arch shape is narrowed or V-shaped. Talking further about class 2 division 2. Class 2 division 2 is characterized by following aspects. The first thing is class 2 molar relationship. As we know, class 2 malocclusion all having the class 2 molar relationship. So class 2 molar relationship is when distal buccal cusp of maxillary first permanent molar occludes in the buccal groove of mandibular first permanent molars. This is distal buccal cusp of maxillary first permanent molar and this is the buccal groove of mandibular first permanent molar. So this has the class 2 molar relationship in class 2 division 2 malocclusion. And the other thing that class 2 division 2 malocclusion should be having is that lingually inclined upper central incisor and buccally inclined upper lateral incisor that overlap the central incisor. So in class 2 division 1 all the incisors are procline, but in case of class 2 division 2 there are lingually inclined upper central incisor and buccally inclined upper lateral incisor. And also there is abnormal path of closure due to excessive tipping of central incisors. Talking about the muscular activity, there is normal perioral muscular activity as compared to class 2 division 1 where there were abnormal muscular activity. In case of class 2 division 2, normal perioral muscular activity is there. Talking about arch shape, upper arch shape is in there they have lingually inclined upper central incisor and buccally inclined upper lateral incisor and that make the arch shape squarish shaped. Talking further, mandibular labial gingival tissue is traumatized by excessively tipped upper central incisor. So this was class 2 division 2 and further video we will talk about class 2 subdivision and then we will talk about the classification of class 3 malocclusion and their subdivisions. So stay tuned for that video and if you like this video don't forget to like, share, subscribe and comment. Thank you so much for watching.